What's up YouTube? Welcome back to the channel. In today's video, we're going to discuss 6 unexpected signs of hormone imbalance. So let's get started. So the most common signs of hormone imbalance that I have discussed several times include fatigue, includes irregular periods, it includes PMS, and it includes persistent weight gain. Those are the basics of what you would come to expect when somebody is experiencing a hormone imbalance. But in today's video, I'm going to go deeper into some unexpected signs that you may have a hormone imbalance. So the first unexpected sign of hormone imbalance is infertility. If you are of age and you are trying to conceive, you will find that if you have not conceived within 6 to 12 months, it is worth further evaluation. There is most likely something off. It may be within you, it may be within your partner, it may be a timing issue. However, this is definitely a sign that you want to get checked out because it's not one of those things that is considered normal after 6 to 12 months of trying during the prime time in your cycle. All other variables come equal. So make sure you get this looked at if you are dealing with infertility. Number 2 is hair loss. So I'm not just talking about a little bit of shedding in the shower, shedding in the hairbrush. I'm not talking about that because you have to remember hair loss is a sign of PCOS, which is polycystic ovarian syndrome, and hair loss is also common with pregnancy. It also can be the result of skin conditions related to psoriasis and other dermatitis. So the thing is, if you are losing hair, losing substantial amounts of hair, if you're starting to see thinning in the hairline, in the back of the scalp, or you're just losing large chunks of hair, this is definitely a cause for concern. And it is definitely something that could be the result of PCOS. Pelvic pain, number 3. So if you are experiencing pelvic pain during your period or during intercourse, this is something you want to get evaluated immediately. This could be the result of fibroids, this could be the result of endometriosis, this could be the result of ovarian cysts, and all of these are related to your hormone levels. So do not take that type of pain lightly. If something feels off, if something feels like it's cramping inside of your uterus, inside of anything in that area, if you are feeling pain, it is not normal and you need to get it checked out. Number 4, cold hands and feet. Now, I'm not just talking about once in a while having cold hands and feet. I'm talking if this is a persistent underlying condition that you frequent and it is correlated to changes in your skin tone. This could be the result of an underlying condition such as diabetes, such as lupus, or something a little bit even more serious because this is an issue with your nerves and your blood circulation, and it's something you do not want to ignore. So if your extremities are constantly cold all of the time, this is something you do want to get looked at. Number 5 is heavy menstrual periods. Having a heavy flow during your cycle isn't necessarily painful, but it can be alarming, especially if the amount of flow that is coming out of your body is causing for concern. If it gets to the point where you need to be changing your pad or tampons at a level of frequency that is abnormal, you may want to get that evaluated because this is a potential sign of cysts, of fibroids, and this can be addressed surgically. This can be addressed medically with medication, but heavy menstrual flow tends to be strongly correlated to the presence of fibroids. And also, everybody keep in mind, I hate to be the bearer of bad news, caffeine does increase fibroid growth. So if you have fibroids and you are prone to fibroids, there are a lot of scientific studies that show that caffeine causes fibroids to increase. So if this is you, you want to lay off the caffeine because it's going to make a very big difference in your specific situation. And last but not least, number 6, unexpected sign of hormone imbalance is breast discharge. If you are experiencing breast discharge and you are not nursing, you are not breastfeeding, and there is a milky discharge coming out of your breast, this is a sign that there is discharge coming as a result of an imbalance in your brain. This can lead to visual changes and issues with ovulation, as well as the length of your menstrual cycle, and medical treatment is usually effective. So please keep in mind, you guys, that Hormone imbalances do happen to the best of us. They can be addressed. And the reason why I'm going through this detailed list of unexpected symptoms is because I don't want you guys to have certain things that could easily be addressed that you are blatantly ignoring. So if you are experiencing any of these unexpected symptoms in this video, please comment below. Let's have a discussion. Let's share information and experiences so that way we can help each other get healthy. So thank you guys for watching, and I'll see you in the next one.